Chairman, thank you for recognizing me, and I want to say thank you to the lady from Lebanon to let me butt up in line. Mr. Secretary, you said something earlier that threw me off, and I'm wondering if I'm living in another Pennsylvania again. Opioids, prescription drugs, are the biggest drug threat to our youth in Pennsylvania today, correct?
That is correct.
Well, the other day we had the Attorney General in here, and she was telling me that the drug trade's being run by Mexican cartels. Now, neither one of those hold true to Western Pennsylvania where I live. I'll tell you point blank, there's a trainload of heroin coming out of Detroit through Cleveland and Newcastle and landing in Pittsburgh weekly. It then bounces back up the Allegheny River to me. Perhaps, just perhaps, in looking at the problems our youth are having today, I don't know how you go about tracking contraband items, so I understand the challenge you have in trying to measure heroin addiction. We are right next to Butler, okay, who is also a rampant heroin zone. Armstrong County, 72,000 people, Mr. Secretary. That ain't much. My hometown's only 3,500 people. That ain't much either. But when we're dragging them out 3 a week,
I know,
in bags, we've got a problem.
You're absolutely right. You're absolutely right. They begin, particularly with our kids, they begin with prescription opioids, and then if we don't intervene, if we keep letting this happen, they do very commonly shift to heroin. But just in Westmoreland County, where they have a
It's not a shift, Mr. Secretary.
You think they're
starting right out the pipe, because you can buy the stuff for about $5 on just about any corner. And our cops, yeah, Mr. Secretary, I used to be mayor of my town. I've done dozens of drug interdictions, ridden with them hundreds of times. I'm asking, please, if you could switch focus a little bit. For central western Pennsylvania, we're kind of the crossroads for everything, moving out of the Northeast to the Midwest. Moving from New York State south, we're dead smack in the middle of it. It's getting rough.
Yes, I understand, and regardless of whether they're addicted to prescription opioids or heroin, my department's focus is to, first of all, do robust prevention work, which is life skills training is a good example of that, and I hope that we can partner with you in getting your school districts. It doesn't matter in terms of treatment for once somebody's addicted. If they're addicted to prescription opioids or addicted to heroin, we still have to do the assessment, match the level of treatment. So, you know, my department doesn't do law enforcement, and I am a law enforcement person. I did 26 years in the district attorney's office. I believe in it, and I hope that law enforcement very, very aggressively continues to go after the heroin dealing. But just to give an example, in Westmoreland County, where they had 64 drug overdose deaths, 9 of those 64 were heroin overdoses, whereas it looks like, well, the overwhelming majority of the 64, this is just in Westmoreland County. I don't have the figures for your county. It may be different, but the overwhelming majority were individuals who had mixes of prescription drugs.
Cocktails.
So, right. But regardless, I think we're on the same team. I mean, we want to make sure we get the resources to our kids, that we get them into, first of all, we keep them out of this in the first place, and we want to do everything possible to do that, because our kids are our first priority, and that we get them the treatment they need. We make sure we have the resources to get them the treatment they need, and it doesn't, again, whether they're addicted to heroin or whether they started with heroin or prescription drugs, you know, it's an important issue. But from our perspective, we want to make sure we get them the help they need.
Well, I thank you very, very much for that. It really is heartbreaking, and I don't want to diminish the efforts being put in by the Armstrong, Indiana Drug and Alcohol Commission, because Cammie Anderson, in my opinion, is a saint, man. She attacks.
Wonderful.
She is, and she lives right behind my office, so she's not shy about stopping to give me her opinion.
She's great.
One more thing, and this is switching gears. The community health centers. You said Armstrong County was being selected as a pilot for this program, moving our workers out of Armstrong into Butler County. The pilot you referenced earlier.
The pilot with Armstrong and Clarion County, it was actually because of Cammie, because she has Armstrong and Clarion County. This is a project where we are sending in, the county drug and alcohol office is sending in recovery specialists into the county jails and they're doing the initial drug and alcohol assessment of anybody that's slated for release. If it looks like they need drug and alcohol, then they do that screening, and then actually they do the assessments. If it looks like that's what they need residential, they are facilitating with Department of Public Welfare. They have with the County Administrative Office, DPW, and they're basically, and we chose Armstrong, Clarion, Indiana because of Cammie, because she's so good, and we also have a strong DPW offices there, and we have good DAs. All the stakeholders there are very strong. So that's where we began. November 1st is when the pilot began there, so that when people are leaving Armstrong County Jail or Clarion County Jail, we want them to be able to have their health choices turned on the day they walk out. So when they leave jail, they go straight from jail to residential treatment. We don't want them to hit the streets because that's a very, very high risk period of time. Those numbers we're working on, part of the reason for doing the pilot and picking your county is it's a great chance to work out the glitches. See, well, what is it that gets in the way? They're going to be everywhere. So, yeah. So
always happy to help work out the glitches, Secretary.
Oh, that's it. But you also are getting the benefit earlier than everybody else. So it's been we're really excited about the project, and we were excited to start there.
Excellent point. Thank you, Chairman, and thank you, Mr. Secretary.